Effects of gases. In this module, we will take a look at the dangerous effects of some gases on divers. We will also examine how to intervene without getting into the water and what actions to take if the casualty is in respiratory arrest. Oxygen toxicity. Breathing pure oxygen at a depth greater than 6 meters, 20 feet, where the partial pressure of oxygen, PO2, is equal to 1.6 atmospheres, can be very dangerous. If you have attended the PSS Nitrox course, you learn that you must never exceed the maximum operating depth specific for each particular gas. In general, the established limit is a partial pressure of oxygen of 1.4 atmospheres. When breathing air, this would mean that you must go no deeper than 56 meters, 186 feet, an unreachable depth in recreational diving. However, using a nitrox mix with 36% oxygen, this limit is reached at a little less than 29 meters, 95 feet. What happens if you breathe oxygen at a dangerous partial pressure level by mistake? There is the risk of acute oxygen poisoning to the central nervous system, with dangerous neurological effects, which can occur without warning. Alterations to vision, alteration to hearing, irritability, confusion, dizziness, pins and needles, often on the lips, and even convulsions. A diver suffering from this runs a serious risk of drowning once they begin breathing again after the convulsions. If a diver shows signs of acute oxygen poisoning, they must ascend immediately to a shallower depth and abort the dive. In case of convulsions, the diver must be brought to the surface as quickly as possible to prevent them drowning. If the regulator has come out of their mouth, don't waste time trying to put it back in. Normally, the first phase of convulsions is that the mouth is clenched tightly shut. If instead the victim has kept the mouthpiece in their mouth, hold it in position so they don't lose it when they come out of the tonic phase of the convulsive crisis. Once on the surface, begin the first aid procedures appropriate to a case of near drowning, but also those for an embolism or AGE, as you learned on the PSS First Aid CPR and Oxygen in Diving Emergencies courses. When removing the mouthpiece from the casualty's mouth, do so delicately and make sure it is complete. During the tonic phase, they could bite off part of the mouthpiece, which could be pushed into the airways and create an obstruction. Think also of your own safety. In case of a rapid ascent or a missed decompression stop, it is advisable that, once on the surface, you also breathe normobaric oxygen. Breathing contaminated air. The air we breathe underwater must be pure. The presence of contaminants in the cylinder can cause serious problems. Carbon monoxide is a gas produced from the incomplete combustion of fuels, such as petrol or diesel. This gas may be present if the compressor takes in the exhaust fumes of the motor running the compressor or from passing traffic, or it may even come from burned lubricants inside the compressor. The action of carbon monoxide is insidious because it gradually inhibits the ability of hemoglobin to bind with oxygen. Carbon monoxide is colorless, tasteless and odorless, but other contaminants such as oil change the taste of the air. Any time that the air in your cylinder seems to have an unusual taste, don't use it. If you are already under the water, stop the dive immediately and ascend. If you suffer from dizziness, nausea or confusion on a dive, do not hesitate to tell your buddy and abort the dive. If you see a diver who seems confused, approach them, give them the OK signal, and wait for a response. If their behavior is not normal, they respond too slowly or not at all, you must bring them to the surface. Once on the surface, take out the regulator immediately so they can breathe clean, fresh air. As soon as you are back on the boat or on land, you should breathe pure oxygen. This is the only effective treatment for carbon monoxide poisoning. Near drowning. Drowning, or rather near drowning, is respiratory insufficiency with general tissue hypoxia. During diving activities, drowning is linked to situations of panic or incidents that cause the diver to lose the regulator from their mouth, allowing water to enter the airways. While drowning, our organism puts some protective measures into action. It closes the larynx with the glottis and contracts the muscles. However, not being able to breathe causes a stoppage to the oxygen supply and an accumulation of carbon dioxide that the respiratory center interprets as an absolute need to introduce new air. However, underwater, the moment you open your mouth to let air in, water will enter the airways and digestive tracts. If the diver is conscious, they will begin to cough, have difficulty in breathing and pain in the chest. In more serious cases, the casualty will cough up froth mixed with blood. If the casualty has lost consciousness, you must immediately check to see if they are breathing, and if they are not, you must apply the procedures you learned on the PSS First Aid CPR course. You must take immediate action to get the casualty out of the water so you can give them the first aid treatment they need more efficiently and administer normobaric oxygen if possible. The emergency medical services must always be contacted because a diver may become unconscious or suffer from a cardiorespiratory arrest even after 24 hours. Rescue without entering the water. A rescue carried out on the surface is certainly more immediate and has a greater probability of success compared to one that begins underwater. If the diver is very close, you can help them by just holding out your hand. If they are beyond reach, you can increase your range of action by using a long object, such as a boat hook or an oar. Holding out an object also gives you the advantage of being able to let go quickly if you realize that the diver is pulling on the object too much. If the diver is further away, throw some type of buoyant object tied to a rope, for example a buoy, a fender, a life jacket, and such like. You could also use an inflated buoyancy compensator. By pulling the rope, you can help the diver by towing them towards you, or you can recover the float so you can throw it again if you miss. If the diver is some distance away and there is a small boat available, you should use this to get near the casualty. It is important that the craft is stable and will not overturn when the diver is hoisted on board. Unconscious diver. In the previous module, you learned how to assist a conscious diver in difficulty. We will now look at what to do if the casualty is not conscious. From a safe distance, try calling to them. If they don't answer, approach and assess their state of consciousness. If they are really unconscious, position them so their face is completely out of the water and make them buoyant by jettisoning their weight belt and inflating the buoyancy compensator. But don't inflate the BC so much that it restricts breathing. Check to see if there are any signs of breathing. If the diver is not breathing or is breathing with difficulty, you must ventilate them. The ventilations must be sufficient to raise the chest. The most important priority is to prevent water getting into the casualty's airways. If the casualty is not wearing a mask, you must pinch the nostrils closed each time you ventilate. If they are wearing a mask, you can leave it on to protect the nose, but when you ventilate the casualty, you must push the glass slightly towards the face or pinch their nose closed through the mask's seal. If the casualty begins breathing on their own, continue to protect the airways and get the casualty out of the water as quickly as you can while checking their breathing continuously. If the casualty does not begin breathing, your choice of action depends on the situation. For instance, if a rescue boat is already approaching, stay where you are and continue to administer AV while you begin removing the casualty's equipment. Let's repeat the order of priorities in the case of an unconscious casualty. Assess if conditions are safe enough for you to take action. Act in such a way so as never to put yourself in danger. If possible, approach the casualty without getting in the water. Check if the casualty is conscious. Prevent water getting into the casualty's airways. Ensure that the casualty is fully buoyant. Check that the casualty is breathing. If not breathing, maintain the rhythm of ventilations. If breathing, transport the casualty to the shore or boat using the most direct route. Administering artificial ventilation in the water. Various techniques can be used to administer AV to a diver on the surface, and the choice of which one to use depends essentially on the rescuer and the means available. When in doubt, opt for the method you know best and you can keep up for the longest period of time. The airways must be kept clear and the casualty's head should be extended. Each insufflation must be of the right length and intensity, enough to lift up the chest, and must be followed by a spontaneous expiration. The first technique is that of mouth-to-mouth resuscitation. Position yourself at the casualty's side and put your hand, the one nearest the casualty's legs, under the neck and the other on the forehead, and extend the head slightly. If the diver isn't wearing a mask, pinch the nose closed using the thumb and index finger of the hand placed on the casualty's forehead, and place your lips around the casualty's mouth, making sure you form a good seal. Now, blow into the casualty's mouth until you see the chest move, and then pull away and get your own breath back. Remember to protect the casualty's airways. Give one insufflation every 4 to 5 seconds. Another technique is administering artificial ventilation using a pocket mask. This method has now replaced the obsolete mouth snorkel technique. Using a pocket mask offers various advantages. The face seal ensures good protection from the water splashing into the casualty's mouth. The mask covers both the mouth and the nose. The one-way valve prevents you coming into direct contact with the casualty's saliva or vomit. Position the pocket mask so it covers the mouth and nose, and pass the elastic behind the casualty's head. Take a breath and give one insufflation for about a second, making sure that the chest rises. Pull away and give a new insufflation every 4 to 5 seconds. Removing equipment in the water. Removing a casualty's equipment is of secondary importance in respect to administering artificial ventilation. Remember that the priorities are to ensure that the casualty is buoyant, to avoid water getting into the airways, to administer artificial respiration, and to get them out of the water as quickly as possible. If the exit point is just a few meters away, don't stop to remove the casualty's equipment. If the shore is quite a distance, you might want to take off the equipment, but remember, you only have one hand free to remove the equipment because one hand must always be positioned under the casualty's head. This means that you have to alternate the insufflations with removing the equipment. If you really need more time, give 2 insufflations. Do what you have to do, but be ready to give another 2 breaths after a maximum time of 10 seconds. Equipment should be removed in a logical order. The weights are the first thing to be removed. To remove the BC, open the stomach strap first. If the diver is wearing a dry suit, disconnect the hose. At this point, you can undo the chest strap of the BC and then the shoulder straps. When the buoyancy compensator is completely free, deflate it slightly and pull it from under the casualty. Using the same technique, you can remove your own equipment, but remember to never stop ventilating the casualty for more than 10 seconds. In the next module, we will see how to tow an unconscious casualty and how to get them out of the water and onto the shore. See you soon.